for is that Zoom. Dr. Quinn, how do some mutations make it harder to fight COVID-19?
Well, mutations, as you mentioned, are errors or mistakes. And basically a virus, once it attaches to a cell, it invades the cell, and once inside uses the machinery of the cell to reproduce itself, make more copies. Well, the mutation in the case of COVID-19 occurred with one mistake, which resulted in copies and copies, hundreds and thousands of this new mutated virus. But the problem is the mutation ended up being an advantage where it had more of the spike proteins. These are the structures on the surface of the virus that allow it to attach to the cells. And by having more of these spike proteins, now it has an advantage and it's more contagious. It infects more people, and now that's where the problem comes in.
All right, we're hearing more about a strain of the virus called G614. What are its characteristics?
Well, the G mutation, that's what I'm speaking of. It's the form of the COVID-19 virus that is mutated. It's different, but it has more of these spike proteins. And you can think about these spike proteins almost as hooks. So if someone is infected with COVID-19 and they cough or they sneeze or they're just simply talking, some of their respiratory droplets are released into the atmosphere. And if you're in proximity and you don't have COVID-19, there's a chance you will or will not get infected. But due to this new mutated form having all these spike proteins as opposed to before, now there's a much higher probability that you will get infected, and people are getting infected. And the researchers have actually said that this is the reason for the upswing in the pandemic, because the infection rate is so much higher.
Yeah, we're talking about the protein hooks. We always see that graphic of the COVID-19 with the little red triangles all sticking out of it. I guess those little red triangles are the protein hooks then.
That is correct. Those are the spike proteins, and now there are more of them, and now the virus is even more infectious.
All right. Is there any good news with regards to the mutations?
Well, there is some good news. The research has shown that if you do get the mutated form, it's not more virulent, meaning you will not get sicker than if you got the old form, which is good. But we still have to remember, with this increased infection rate, more people are getting infected. We have to worry about the vulnerable population, which now has a higher probability of being exposed. And these are senior citizens and those with chronic medical conditions who can't fight it off. So there's more sickness and there's more death. So we have to continue to wear a mask, social distance, and follow the guidelines of the CDC and our local health representatives.
Absolutely. And I guess until we get the vaccine, that's the order of the day. Wear your mask, wash your hands.
Yes, sir.
All right, Dr. Timothy Quinn practices family medicine in Ridgeland. Thanks for taking a few minutes with us this afternoon.
Hey, thank you.